here. And before we get started, I'd like to mention to everyone watching, there's a Q&A section at the bottom, and that's where we'll be taking questions. So feel free as you think of them throughout our presentation to put them in down there, and we'll get to them at the end. And today we'll be talking to you about 5 ways that a paperless practice can save the practice time and money, and also make the experience better for the patient. And what we mean by that is not simply paperless in the sense of taking your practice digital and the logistics of that. Yes, we'll cover that, but we also want to emphasize the experience that the patient has and the team has when you make that transition to taking your practice fully digital.
And also this is not for people to think that now I'm going to have to move everything. Let's start with this part of practice, which is cumbersome, which is time consuming. I think people may think that, oh, they're trying to say, give up your Soften or Dentrix or whatever, and just come over here. We're just talking about a main feature that every practice needs.
And to kick us off, we'll introduce ourselves. I have my co-panelist with me here, Dr. Kia Kiani. He's been a practicing dentist of over 25 years. And in the last decade, Dr. Kia has also been a practice management software consultant and trainer.
Yes, thank you, Tiffany. And let me introduce you as well. Tiffany has an MBA in technology commercialization, and she's a co-founder of Asprodental. She's the main head of all this. Also, she has a great experience in managing multiple locations, multiple offices.
Thank you, Kia. And before we go into the paperless workflow, let's talk first about the current workflow. So we have a few clients that before switching over to a paperless system, we're running a few different types of operations. So the classic example is your pen and paper, patient intake forms, consent forms, etc. The patient comes in, they fill in the form in the office, then the front office team member will type over the information that was written and put that into the patient's chart, and then scan the written filled out form and then upload that into the patient's chart. So that leaves us with a lot of cumbersome data re-entry and lots of paper to shred, and it's overall quite a clunky system. There's also the hybrid solution that we see a lot. We had another client who was previously using a third-party online consents portal through another company, and then also their practice management system. And they would create the forms, have the patient sign electronically, then still have to download those signed forms as PDFs and upload into the patient's chart. So while that's still more digital, it takes a few extra steps as well. And what we can eliminate with keeping everything fully in one dental management workflow is to keep it less steps, which saves the entire team time.
Yeah, now, and let's not forget that filling out these forms means patients sitting in the waiting room and doing it. And no patient I have ever seen anybody who would enjoy that. So, I would say
I agree. They barely want to come to the practice as it is for their dental appointment.
Absolutely.
So one of the downsides of paper is that lost time. More than just the team's time doing the data entry, there's also the lost one-on-one time that you have with the patient. So just a quick example, even though this is a dental webinar, any medical or office runs pretty similarly. So about a year ago, I was in an ophthalmologist's office for my LASIK appointment to get a consult. And I was really excited about the appointment to get the procedure done. When I arrived, I signed off on all the COVID stuff, and then I was handed a gigantic stack of consents to look over and sign and medical history to fill out before we could proceed. So as I was sitting there, 5 minutes, 10 minutes, 15, flipping through and signing everything, it brought my excitement level and mood as the patient down a few notches. So as you know, the way a patient is greeted in the practice when they come in sets a big tone for their appointment, and it's the first interaction. So wouldn't it be much more pleasant if I had done all of this on my own time, and then when I could come in as a patient, be greeted and taken straight back to the provider? So that's one element of the lost time that we don't often think about. And of course,
Absolutely.
on the team
And
side,
you know, 25 years of doing dentistry, I tell you, I can guarantee you any dentist who's listening to us at this moment would attest to this, that the longer you keep the patient waiting in the waiting room, the lower the treatment acceptance goes. So this goes hand in hand. A happier patient is a patient who comes into the office, almost no wait time, and is in the chair and out of the office.
agreed. And then on the other side of that, the lost time that's pretty obvious on the team side is that printing, scanning, uploading, and data entry. And then, of course, deciphering people's handwriting. The other downside of paper is general cost. So your hard costs, such as the paper itself, ink cartridges, pens, clipboards, sanitizing, all of those things. And of course, the biggest cost is time, which in terms of your team's time. It's also outdated. Any practice that has, let's say, a CEREC or a laser or a piano, even just digital x-rays, you're a modern practice. And when your patients come in and see paper floating around that they have to fill out and this outdated process, it's reminiscent of using a fax machine, which a lot of offices still use because it's necessary in some sense, but to patients, it seems like a mismatch to the rest of the modern practice. And of course, hygiene, which is more important now than ever. Patients are actually paying attention and paying attention to touch points specifically. So a quick story, we had a practice that was telling me one of their patients, new patient, comes in with a pen of her own so that she doesn't have to touch anything in the practice. And when she hears that the forms can be emailed so that she doesn't have to even touch paper in the practice, she actually stands in the middle of the room and asks the front desk ladies to email her the forms so she can fill them out on her own phone right there and then and go straight back to the operatory. So I realize not every patient is to that extent, but it definitely decreases those touch points, your team's time to sanitize the pens, and it also leaves a good impression for the patient as well.
Absolutely.
And then now the upsides of paperless, patients prefer it. We've actually had practices tell us that their patients think it's really cool how easily they can fill out forms, especially in the comfort of their own homes. Well, some of them. We have so I guess the patients will get used to the process and start filling them out on their own time more and more as the system is implemented. A lot of practices we've spoken to have said that after a few months, a few weeks, depending on the practice, that a majority of their patients do actually fill out the forms beforehand once they get used to the office's system, and then they actually prefer that. And one of our practices actually says that sometimes they'll see the patients walking in the door and filling things out on their phone, but that's still before the appointment time. So it works out better for everyone there. And we'll show you a quick clip of what it looks like and how easy it is for a patient.
Before you show that clip, let me tell you something about my brother. My brother actually bought into this portal, patient portal, for patient forms and things like that. First of all, people kept calling the office with their username and password. That didn't work. So the patients told him, give me a simple solution. Send me something that I can just click and get it done without cumbersome portals, without logging into this and that. And I guess this is what you're going to show people now.
Yeah, that's a great point, Kia. Another part of patients actually doing what we ask is that it's easy for them. The more steps it is, the more difficult it is, the less likely they're actually going to do it. And here we'll see, this is so in the practice, you'll see that there's a history of when the patient intake form was sent. And then here it's a blank where the address is on their profile. Now that's before they fill it out. On the patient's perspective, this laptop on the right, let's say the patient is at home, they receive an email with a link to fill out their form. They click on the link, it takes them to a secure encrypted direct link to their profile. They can fill out their demographics. Filling out themselves leaves the responsibility in the patient's hands for the accuracy of the data. So no typo issues from the practice or deciphering the handwriting like we talked about. I mean, of course, if the patient misspells something, that's on them, but it saves that extra step where an error can be made. And one of the beauties of seeing this information before the appointment and sending out the links is that the provider can check all of the patient's responses to their medical history before they come in. And that makes you a lot more prepared for the day, makes the day go smoother. And once the patient is finished, confirmation screen, back in the practice on the screen on the left, if we refresh the page, the information that the patient filled out gets sent in real time. And if we go to the health history tab, there's a last updated date with all of the conditions and allergies, any medications, dental history that the patient has submitted, and their signature.
Great. And as a doctor, if the patient missed something or forgot to mention about an allergy or a medical condition, I would have the power to modify this and correct it and get the patient consent on it again.
Exactly. Another upside of being digital and paperless is that it saves the team's time. So like you saw in that last video clip, the information goes in the patient's chart and profile automatically. You don't have to re-enter it. And the medical history does as well. So there's less printing, scanning, and a better example of that, even more so, is the consent forms, because that normally is after you have your first patient appointment with the intake form, we do a lot of consents, especially now every appointment with a COVID screening, right? So this is how you select the consent forms, and every appointment, probably a screening, HIPAA if they're a new patient, any potential treatment, and the forms are customizable and editable. So you can put in any notes before you send it off to the patient. For example, on the HIPAA note, on the treatment, perhaps maybe the tooth number or surfaces or anything like that. And then sending this to the patient beforehand saves the office some time in the practice. And there's a history of what was sent and when. And on the patient's perspective, they can do this on any device, whether it's their phone, a tablet, iPad, laptop at home, going through and signing all of the consents that were sent to them.
Not to mention how much paper you are saving, how much ink, and you're helping the environment. You're practically saving the planet.
Very environmentally friendly. And then once a patient is finished, they get a confirmation, and then back in the practice, we'll go to the Documents tab and see that everything that was signed gets filed in as a PDF automatically with the patient's signature. So here is an automation of probably, let's see, printing a paper form, having the patient fill it out, and scanning it and uploading. So it saves about 4 steps right there. And with that time, the team can now refocus what they would be spending the busy work time on to do other things that would bring in more revenue for the practice, whether it's calling additional patients and reaching out to fill the schedule, things that their time could be better spent on. And of course, for modernizing the practice, in addition to having those consent forms automatically filed in, those forms are also searchable, which we don't quite get with paper forms. We would have to flip through, whereas anything that is stored online, you can look through like a search on your phone or your email to find exactly what you need. And it's not
So
just
even if
forms.
so, if it's a paper and it's misfiled, good luck finding it. But if it's electronic and you can search it within seconds, that's a different story.
Agreed. And more than just the intake forms and consent forms, being able to do electronic treatment plans can open up a lot of workflow opportunities for your practice. So let's say there's a patient here who's going to sign the consent form in the practice. Perhaps the treatment coordinator goes into the operatory with an iPad, and this is the treatment plan. Any notes, template notes can be added. The treatment plan can be emailed to the patient to sign if they're in a hurry, or it can be signed chairside. And then once the form is saved and confirmed in the practice, we can go to the patient's documents tab where the treatment consents were stored and see that the treatment plan is also filed in there with the patient's signature. And as soon as that happens, the patient also receives a treatment plan confirmation in their email with a copy of what they have signed. So this is great for, we have a practice who they see a lot of families. Sometimes mom comes in and the kids need a lot of treatment and she would like to show the treatment plan to dad or vice versa, or even whether it's a spouse that you're sharing your treatment plan with. I was told that there's this one patient in the practice who every time the treatment coordinator shows him a treatment plan, he makes sure to watch her click confirm, and then he pulls out his phone to verify that he got the treatment plan email before he leaves the practice, because he needs to show it to his wife before he actually goes ahead and makes the appointment. I think we also have, so these forms can be emailed. One of our practices was saying that they have a lot of busy parents, a lot of school teachers. So people are normally on the go. And sometimes the patients don't have time to sit there and review the treatment plan. If it's a patient that you know pretty well, you can email the treatment plan and either call them to go over it together or give them the freedom to sign it on their own time. And then that way it saves the patient an extra trip back to the practice.
Absolutely. That's amazing. And by the way, all this data is backed up several times throughout the country by Amazon. So you can trust that nothing will get ever lost.
That's true. Every time a treatment plan is sent, there's a PDF copy, even if it's not signed, with the date stamp of when it's sent. So that was also an extra catch for the team. And then another upside is that of the paperless is being more hygienic. Patients can use their own device, or they can use one device in your practice at the front desk that they can use to sign off on things, which is a lot less surfaces to sanitize than, let's say, a whole bowl of pens or a bunch of paper floating around the practice.
Absolutely.
And of course, everything comes back to saving the practice money, because if you can save your team time on all of that busy work and they can spend that time doing things that will actually help grow your practice, then imagine all of the value there. So instead of printing out forms for the next day, or instead of uploading everyone's paper to their charts, which could be anywhere from a few minutes to a few hours if the front desk keeps getting interrupted by phone calls, by in-person patients and things like that, that time can be spent calling patients who are overdue for hygiene, calling patients who have unaccepted treatment, filling a schedule for tomorrow, the next day, and pretty much anything aside from shuffling paper.
Yeah. So you mean to say there is no kiosk, there is no clipboard anymore?
Well, you could have an iPad station if you'd like, but there's no need for any of the extra equipment. It's just what you would like for your own practice. And in conclusion, we were planning on focusing on 5 ways, but there are a lot more secondary benefits to keep getting your practice paperless. So the 5 most important ones that we saw are, first of all, the patient does the paperwork at home. This is great for the practice because You can review your consent forms and health history the day before if the forms are sent a few days in advance of the appointment. And that way, the entire team, the provider, the hygienist, the dental assistants are more prepared for the patient when they come in. When the patient does come in, they get greeted and immediately taken back to the operatory, which is a much more pleasant bedside experience for the patient as well. Like Dr. Kia said earlier, the storage and backup in the cloud that's searchable for these documents that you have signed. This is really important because let's say we have physical files in the practice. Anything can happen to those documents. They can fall between the gap between the desk and the wall, or paper, coffee can be spilled on them, anything, God forbid, any natural disasters. But having them stored in the cloud with redundant backups, which is what you were mentioning, we work with
Mm-hmm.
Amazon Web Services on their HIPAA compliant servers across the nation. These are the same servers used by the CIA, by companies like Siemens, very reputable. And your data is stored across multiple of these servers. So if anything happens to one, there's always a backup out there. And the backups happen every few hours, they're stored forever. So your data is a lot more, there are a lot more caches than having it in one place in your practice. The physical costs of papers and printers, that is a fairly clear one there, and the extra steps involved in doing all of those physical things. No double re-entry. So that is a multifaceted benefit as well, because first of all, there's a time aspect of retyping and everything, but there's the secondary, let's say a typo is made in a insurance group number, or a typo is made in the patient's address. The insurance claim would get denied due to the subscriber address being wrong, being sent to the wrong plan, etc. And the additional time spent hunting down that information to resubmit things can be quite a time suck for the team.
Mm-hmm.
And then all of this comes back to freeing up the team's time so that you can spend more time with your existing patients or see more patients once a workflow gets more efficient. And of course, patients prefer that. It's more hygienic. The treatment plans can be digital, which allows you more options to present the plans. And an updated workflow brings you one step closer to being on a fully cloud system, which we're all moving toward at some point or another.
Absolutely. Thank you, Tiffany. Excellent.
Now, if you're still not convinced on going paperless, or you're unsure of how exactly to proceed for your practice, we're offering a complimentary 20-minute software consultation call by phone or Zoom, whichever is more convenient for you. And during this call, we can go over your exact office situation and see what steps would be required to take you digital for your practice in specifically. Very personalized and tailored consulting. And if you would like additional resources such as an ebook or a software comparison chart, feel free to call us, email us, use our website chat. We are available to provide you these resources. And lastly, our Easy Paperless product that we have shown you during these the little video clips previously. It is $195 a month, no setup fees, and that is a webinar special. So when you reach out to us, definitely mention that you were watching this webinar and heard about the Easy Paperless products from there.
I want to also mention that your entire patient list will be moved to a copy of that will be moved to this program, so you don't have to start typing your new patients or old patients information into the program.
Actually, that's a great segue into Q&A, Dr. Kia, because that was one of the questions. All right. If I start using the software, how do I get my patient information? Do I have to retype everything? So this is, if you're using any computer-based practice management system, it should be very easy to export a demographics list of your patients, their contact information. And if we'll show you how, if you're not familiar with it, but it's simple patient report. And we can import that information in, and that way, when you want to send anything to your patients, you can just pick them from your demographics list and send that form. If you are using paper charts still and don't have a digital history of your patients, then of course that would be, you would want to type in the name of each patient and their contact information and start from there. Another question here. I'm not interested in switching practice management software. Can I just use your paperless software? Yes, definitely. Our Easy Paperless module is a standalone, and in addition to the intake forms, the consent forms, and the treatment plans, we also are offering free two-way texting and picture messaging. So this comes really in handy. We have a lot of practices who send out their consent forms about 3 or 4 days before the 3 or 4 days before the patients are supposed to come in for their appointment. So the office staff will check the day before to make sure that everything is signed. And if it's not, then they can send the patient a quick text message directly from the software to remind them to fill out that form. And then patients can respond with anything from a question, or they can even send in a picture if they have a concern for their upcoming appointment that you can address. Oh, this is funny. The question right after is, if I'm using the Easy Paperless, can I switch to the full practice management software? So the exact opposite. And the answer to that is also yes. It's actually going to be a really smooth transition also, since you'll be working with a part of the software and you'll get a sense of how it looks and feels. But to be honest, Kia, here's a question for you, since you just onboarded someone. How long does it take to learn, to get the staff trained and use the software to become paperless?
This office, they had an office manager, an assistant to the office manager, and 2 assistants, plus a hygienist, a full-time hygienist, and a part-time hygienist. We trained the whole office practically in 3 sessions. Each session took about an hour and a half. Actually, less than that, because some of the time just kind of we were just chit-chatting. So it's such an intuitive program that I would say a lot of people can figure things out on their own, but of course we will train them. Now that's for the full package office, but for the easy paperless, that practically takes 1 session and maybe half an hour, if not, if that.
I would say that's pretty typical from the practices I've trained on the paperless product also. I would say you could practically train someone how to use it and they could use it that same day. And the reason why I say that is because so for some of our practices where they're using the entire practice management software and they have a front office, a new staff member who their job is to send out the consents and make sure all the paperwork is in, etc. They can teach that person how to do the task in about an hour or so, and that person can start their job that day.
Absolutely. So for easy paperless, it's really easy, 20 minutes, and you're all set.
Another question here. If I'm ready to go, how long will it take to onboard and any onboarding fees? So no onboarding fees that's as far as we know, for a limited time, $195 a month to get started, and that's it. And how long does it take to get started? I would say about 2 to 3 days to set everything up for you. During that time, we set up your email address so that all of the consent forms will come from your practice's email, which your patients will recognize. And we'll set up the texting number so that any calls to that number will forward to your office line. That way the patients can contact you either way and respond there. See let me see. Oh, do I still need a server? So for this product, no, you do not. You can use any device, whether it's a phone, a tablet meaning like an iOS or a Surface, Microsoft Surface, or an iPad, and also any computers or laptops as well. Basically, any device where you can pull up a web page. So if you can pull up facebook.com, google.com, any of those, you'll be able to pull up the Easy Paperless product and start sending consents to your patients and view them. If desired, can a copy of records be printed? Yes. So everything is digital like you saw, but in the patient's documents tab where we saw that the treatment plan gets filed into automatically and also the consent forms get filed into, those are saved as PDFs. So yes, you can download them and print them and send to the patients or do anything else you need with them. Do I have to be on the latest version of Windows or Mac OS? You do not. So this operating system of your computer itself does not matter. It's the web browser. So as long as you can pull up regular web pages, then you're fine. We can't speak to, of course, if your computer is 20 years old, it may load things a little bit more slowly. But in general, we have our clients using all sorts of devices and switching back and forth between them. It gives you a lot of freedom when you're on.
I want to say something. Even if you have one of those very old computers, still contact us. We will have a solution for you.
Yep. All right. I think we are nearing the end of our time, and a few of these questions are repeats and a few are specific. So if you have anything specific to your practice and your name is on here, we'll reach out to you directly. If not, please leave your contact information and we will make sure to address those with you. If there are no other comments or questions, then you have our contact information here. You'll receive a recording of this webinar to your email as a recorded video. So you can always refer back if you would like to revisit any of the video clips, and feel free to reach out to us directly as well. We would love to speak to any and all of you. Absolutely. Thank you for joining us, and we'll see you on our next webinar.
Thank you, everybody.